Number next physiological condition is effect of gastric juice or bile salt. Surfactants in gastric juice or bile salt both will affect the wettability, solubility of drug. These juices in bile salt acting as a surfactant, emulsifying agent, increasing water oil solubility, forming micellization, and this increasing dissolution in which this increased diluted drug is leading to increased absorbance. So if there is lack of surfactant, this surfactant, the GIT drug absorbance will be disturbed. Like in case of pancreatitis, hepatic cirrhosis, pancreatomy effect will drug absorption. Next effect is absorbing surface area. Absorbing surface is the surface area to which drug exposed for the absorption. So the surface area is directly proportional to drug absorption. Greater the surface area, greater will be absorption. Lesser the surface area, lesser will be absorption. And it is very clear from GIT segment, the surface area in the small intestine is so much high. The small intestine is highly populated with villi and further microvilli. That's why the small intestine is the potential absorbing area from which acidic and basic both drug can get absorbed as compared to rest of the GIT segments. Because in stomach surface area is less, esophagus surface area is less, in the anus, colon, the surface area is less, so less absorption will occur. So greater the surface area, greater will be the absorption. The next physiological condition is degradation or inactivation of drug in the GIT. So the degradation and inactivation of drug may occur through microbial normal flora or GIT hydrolytic enzymes, acidic content of the stomach, food constituents of the stomach, and mucin binding. Mucin is glycoprotein, which is the normal component of our stomach, and EHC, enterohepatic circulation. These are the factors which are responsible for the degradation or inactivation of the drugs. Food in the GIT, this is the number 6. So food in GIT disturbing the drug absorption through complex formation, through changing the GIT pH, by competition at transport site, by increasing and disturbing the viscosity of GIT. Let's consider the tetracycline and even the fluoroquinolones group of the antibiotic form complex with dimetal like calcium, iron, and so on. And this complex is inactive material, and the complex is not absorbable, and this complex formation decreasing the drug absorption. Similarly, iron absorption is increased. The absorption of iron is increased due to the food vitamin C contents and the caffeine content of the food increasing the paracetamol efficacy. So that's why we are using paracetamol along with caffeine, that is Panadol Extra. And if you don't have Panadol Extra, you take just Panadol tablet with an extra cup of tea. This is equivalent to Panadol Extra. Sometimes the food changing the GIT pH, if the pH of stomach is disturbed in this way and intestine is disturbed in this way, definitely it will lead to malabsorption. Not good. And competition is transport side. If this is drug and this is food product, food constituent, both competing at this absorbing carrier, so it definitely it will disturb the drug absorption. Increasing the viscosity of GIT also decrease the drug absorption, and diluting the GIT content will increase the absorption. That's why take plenty of water with drug administration. Thank you.